In most clinical trials addressing tungiasis, the drugs employed tend to be either expensive or impractical, posing challenges for local residents in their utilization. However, within communities in western Kenya, a successful treatment approach utilizing sodium carbonate has emerged. It is against this backdrop that we posit our hypothesis that the topical application of 5% sodium carbonate exhibits a non-inferiority margin of no more than 10% compared to dimethicone for tungiasis treatment. This study protocol outlines our plan to conduct a randomized, observer-blinded controlled trial with the aim of assessing this hypothesis. The study will entail two arms, one utilizing 5% sodium carbonate and the other employing dimethicone, with each treatment applied to 1 foot of participants. The setting for this investigation will be state primary schools located in Homa Bay County, Kenya. School children aged 8 to 14 years exhibiting lesions caused by sand fleas will be eligible for enrollment in the study. Upon enrollment, each participant will undergo monitoring for a duration of 7 days post-treatment to assess various parameters including the viability of embedded fleas, clinical signs such as inflammation, and the presence of symptoms. The primary analysis of the study will involve comparing the proportion of deceased fleas between the two treatment groups. Additionally, all adverse events observed during the study period will be meticulously monitored. The overarching goal of this endeavor is to determine the most efficacious treatment option for tungiasis, thereby facilitating its adoption within the community. By elucidating the comparative effectiveness of sodium carbonate and dimethicone, this study endeavors to provide valuable insights into the management of tungiasis. If proven to be non-inferior, the utilization of sodium carbonate could offer a cost-effective and accessible alternative for treating this neglected tropical disease. Moreover, the findings of this research hold the potential to significantly impact public health initiatives, particularly in regions where tungiasis is endemic. Through rigorous scientific inquiry and community engagement, we aspire to contribute towards alleviating the burden of tungiasis and improving the overall well-being of affected populations. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.